name is Knippling. I am the Clinical Informatics Specialist at Brookings Health System in Brookings, South Dakota. We are a 49-bed hospital. We also have a 79-bed long-term care facility and 4 medical clinics, 3 which are medical and 1 which is an eye clinic. We are currently on Meditech 567. We are looking at the 6.1 platform. We haven't made any decisions yet on moving forward with it, but I think that's where everything is going, is 6X. Brookings Health System and Summit Healthcare have a great relationship. It started prior to me coming 6 years ago to the Brookings Health System, and it began with InSync products along with the scripting toolkit. After working with that for a few years, we also purchased the interface engine as well as the provider exchange piece. So Brookings Health System is a small facility. We tend to really evaluate and investigate on products that we're going to purchase. And so with Summit Healthcare, we've found that not only do we receive really quality products, but we receive really great customer service. And that was one of the big, strong pieces that really brought us to do so many projects with Summit Healthcare. Before InSync, I think all Meditech hospitals run into situations trying to get the data. You can go list your dictionaries and compile these long, huge reports that you can see side-by-side views, but it's a manual process. You have one screen open and the other screen say live and test. So the nice thing about InSync was that it runs a comparison report and it puts it all together into one. You can really visualize the data instead of it being 2 manual full screens. The other key piece that InSync brings that regular pulling straight out reports don't offer is that it brings you the ability to really filter your data. The disadvantage of pulling reports straight out of Meditech is that it gives you all the data that's in your dictionary. With InSync, you have the ability to filter and really search for the data that you're looking for specifically. And I think that's one of the key benefits with InSync. Since we lost a key member of our team, we have reevaluated. And what we're doing now is that we're using InSync as a tool for our upgrades. We compare our old tests to our current test environment, seeing if there's any pieces missing. We are a small facility. We only have 5 people in our IT staff. And so it was really key to be able to use a tool that is going to save us time. And we had data in our test environment that wasn't in our current live when our new test environment was made. So we run into scenarios where we've been missing this data. And with InSync, it allows us to run these comparison reports against all of our current rings. So we can run from our past test during an upgrade to our current test and see we are missing these fields. Do we need this data? If we don't need it, we don't need to worry about moving it forward. If we do need it, we need to script it in and really help feed back into that and help build this product for us at Brookings Health System. So I would say with InSync itself, we've seen a great ROI simply because we are a team of 5. So we have limited resources and we wear many hats. I wish I could say we could focus on one thing at a time, but it's just not the case. So I see Brookings Health System and Summit Healthcare continuing to build our relationship. We have many of their resources already. We are going to start looking at the downtime reporting solution that Summit offers to give us a little bit more stability if we do have downtime. Hospitals don't like downtime. We don't plan downtime, but it does happen, unfortunately. And so we're going to be looking at the new solutions that Summit has to offer. So I can see Brookings Health System looking to Summit Healthcare for many of their solutions when it comes to technology and healthcare.